very good morning to you. Let's reflect right at the start, right from the beginning, that actually the problems of the health service, in many respects, are driven by great news because of technological advances, drug advances. We're all living much longer. The impact of that is that the Office of Budget Responsibility suggests that at the moment the 8% of GDP we spend on healthcare will rise to closer to 20% in the next 30, 40, 50 years. It's a good problem to have, but how do we sort out the problem?
Well, unfortunately, a lot of what I've heard seems to be perpetuating the myth that the NHS is unsustainable. But if we compare the NHS to other developed countries, we spend less than most of Europe in terms of GDP spend. We spend half of what America spends on its health service. We have one of the most efficient health services in the world. But the narrative we're hearing from government and health bosses is all pushing us towards user charges and ultimately an insurance-based system. And this is not the direction of travel we want to go.
Yeah. The thing is, well, you say that the right-wing media are saying this, that and the other, but the truth is all mainstream political parties in the UK support the ring-fencing of the National Health Service. I mean, heaven forfend, even look, Nigel Farage of the day was presented with some evidence that he suggested that there ought to be privatisation of the National Health Service. He said that allegedly a couple of years ago, and quickly reversed his ferrets away from that policy and said, oh no, I support ring-fencing the NHS. It's completely safe.
Well, none of the politicians will publicly admit their actual end-game goal is to turn it into an American insurance system because it's political suicide. They might be ring-fencing the budget, but what they're also doing is diverting massive amount of public money into instruments which are needed to drive an insurance-based, marketised health system. The administration costs for the NHS have gone up from 5% to above 14%, and we're headed in the American direction, which is 30%. So this is removing money away from patient care and into the pockets of private corporations and the insurance industry and very many other vested interests. So they are diverting money away from patient care, and this is what's going on. This is a major conflict that's needs to be exposed.
Well, Lord Warner, do you recognise this picture of government policy being painted by Bob Gill? I mean, in the eyes of many people, you've got a situation at the moment where money's tight, will be tight as the NHS budget continues to expand. Actually, politicians say we're going to ring-fence that spending. Bob Gill says we're going down a road that takes us towards American-style privatisation. Other people will say, actually, what's got to give here is spending on all the other areas of public spending in British life. Defence, Home Office, education, you name it, apart from our health service.
Well, I don't recognise the fact that we're going down a path towards an insurance system. I'm strongly opposed to an insurance system. What we are seeing is that the NHS is finally being forced to really become efficient. I mean, the variation in the quality of services around the country is staggering. And one of the issues that I think Simon Stevens is pointing to in his forward view is that we've got to get real about using technology in the health service. We're bad at that in this country. And we've got to actually move more of our services into the community, integrated with social care, so that we don't go on treating people in the most expensive and often the most inappropriate place, which is an acute hospital.
Can we just think about some of the lateral ideas that have been presented to change things? Where do we stand, gentlemen, on things like competition? I mean, Lord Warner, they say, you know, you've got units that do very well. We should encourage more people to go there, shouldn't we? I mean, what's wrong? Actually, Bob, let me address this question to you. What's wrong with saying to a pregnant woman, here's a voucher, you know, the taxpayer's still paying for that, here's a voucher for you to spend where you like. You decide where you want to have your baby, you decide which maternity unit you want to go to, and over time the effect of that will be to make sure that the maternity units which are working well will be more successful.
Well, the argument that markets work in healthcare is fundamentally flawed. Patients do not have a medical degree. They cannot make informed choices.
You don't need a medical degree to go onto the internet and see the league tables and see what's working, what's doing well, what's not.
Well, the league tables have their own flaws. They only measure what is measurable. If you drive everybody to centres of excellence, well, they can't keep up with the demand. The rationale should be to improve everybody's level of performance. But what we're being softened up for are patient user charges Lord Warner proposed in his paper, which was published by Reform, that we should all start contributing £10 to be a member of the NHS club. Well, this is user charges. User charges put off people seeking care, and this has been shown with international studies as an effect of increasing maternal mortality, infant mortality, patients delay seeking help. This is a very blunt tool, and it's not the solution to the problem. The solution to the problem, if he wants to drive up efficiency, maybe he should remove the market, which is sucking out £10 billion from the NHS.
There's a couple of things there, aren't there? Just on the first point about, a successful place can't cope with extra demand. Lord Warner, we look, for instance, to India. You give somebody a voucher to go and have a hip replacement, they can maybe go to India, where there is, infinite supply of high, maybe in time, a less finite supply of great clinics and etc. The second point, and Bob Gill's charge against you, is that this £10 charge idea, for instance, is the thin end of the wedge, isn't it? It establishes the principle of charging and allows over time for it to be increased bit by bit.
Well, I think as someone who actually introduced more competition when I was a health minister under Tony Blair, what we found was with elective surgery that patients liked the service, it forced the NHS to improve, and the outcomes were both beneficial in terms of value and in terms of patient experience. So, and there's a lot of academic research showing that competition works. Bob Gill is just plain wrong. What you need to be able to do is actually ensure that the people coming into the market are going to offer a better deal for the patient and for the taxpayer than the present incumbents. And I have to say to Bob, I think he's in cloud cuckoo land if he believes that the NHS on its own will actually change its ways. And we do need to do what you're saying. Let the better providers provide more of the services. Let's have a proper market within the NHS itself. You don't have to go to India to get better services.
Lord Warner's sounding like a scratch record. What the public need to be aware of is the proponents of more market, more privatisation and the insurance model. We need to look at these people's conflicts of interest. I'd like to read a statement which was published by Unite earlier this year. Lord Warner works as an advisor for Zansa, a technology firm, and Biotrol, an antimicrobial company, which both sells services and products to the NHS, and was paid by DLA Piper, which advises ministers on the 12 billion IT project for the NHS, projects that he was responsible for when he was a government minister. The whole Department of Health has been inundated with people with vested interest in privatisation.
All right, I'll tell you what, Bob, just hold it there. Bob, just hold it there. I'll tell you for why. Because that may be, it may not be, that may be a fairly serious charge to level against Lord Warner. I've not had sight of that before.
Well,
we didn't know you were going to quote that.
So I've just read an article from Unite which is available for everybody to read.
All right. Well, let him answer that. You are pushing an agenda that's driven by vested interest. That's quite a serious accusation. How do you answer?
That's not true. I just declare my interest. I also do work. I'm doing work in Birmingham for the government on trying to improve the children's public services in Birmingham. So I'm motivated by what's best for patients and service users. And I've been in the NHS, I use the NHS, and I've seen this service perform excellently, and I've seen it perform appallingly. And there's no getting away from that. And what I was accused of actually introducing charges on a monthly basis. What we were proposing there was a £10 a month payment for those who could afford it, with exemptions, collected through council tax, to improve the quality of preventative services at the local level, with all the decisions on that money being taken by local people. That's not privatisation, that's decentralisation, putting users more in charge of some of the services.
Bob Gill, what do you... Sorry, go on.
Well, we have a very efficient system of funding the NHS. It's called general taxation. We don't need to use yet another level of bureaucracy. Although it might sound very reasonable at £10, this will soon escalate, as we saw over tuition fees.
But so will general taxation. So will general taxation. So will general taxation. Let me just read.
General taxation does not require a separate structure of collecting the fees.
Let's go full circle. Let's just start with that statistic I started our debate with today. The proportion of GDP that will go on our health service in coming decades, currently 8%, will rise to 20%. That's a function of increasing longevity, improving technology, the bills are going to keep going up and through the roof, and your solution is simply to keep on rising taxes to pay for them. Our survey today says only 30% of people support that strategy. But the health chiefs, of course, Conservative too, they all love the idea, but they would, wouldn't they?
Well, I don't recognise those figures as being credible. 20% GDP in terms of health. Well, this is a government. This is not independent. This is a government voice box. The policies that we are pursuing will divert more money away from patient care. That's the fundamental problem which you don't seem to be grasping. The amount diverted away into administration costs and profit for corporations who are increasingly slicing open the NHS are increasing, and that is taking money away from the front line. And that's the fundamental thing that Lord Warner refuses to answer. And you know, he published his paper through Reform. Well, let's look at the links that Reform have to companies and corporations that will profit from privatisation. You know, outsourcing companies, big pharma, private health insurance companies, McKinsey's, management consultancies. These are the companies that are profiting whilst creating the myths of unsustainability, and the NHS isn't working. So we're having a drip, drip, drip propaganda against the NHS because they'll find it hard to reform and privatise something that is functioning well. Okay. The government is deliberately underfunding the NHS, and that's the fundamental truth.
Trying to keep this balanced. Lord Warner, you get the last word.
Well, I think that we've got to actually face up as a country to the fact that we've got to change the NHS. That doesn't mean going down a privatisation or insurance route. It does mean treating more people in the community, a better deal for social care, which I would criticise this government for, in the way they have actually starved local authorities of the money for good adult social care. But the idea that we can go on just raising general taxation and national insurance is frankly fanciful. There is a public resistance to it, and a good reason for that, because they are taxes on jobs. And we don't want to do that. Unemployment is really bad for your health. So we can't just raise taxes.
Okay, gentlemen, we've got to wind it up there. That seems like the right moment. Lord Warner, Bob Gill, thanks both very much indeed.
Thank you.
Well, this is Sky News coming up after the break. All the business plus